Hi friends, welcome to Diagnox. Today we have an interesting case, an impacted mandibular second premolar. This is a cone beam CT scan taken with a limited FOV. It's taken with 6 into 7 centimeters so that these areas are not clear, only the area of interest is very clear. You have missing 3-5, you have an impacted 3-5. So panoramic reconstructed slices gives very limited information regarding the position of impacted teeth. We will move on to the cross-sectional, axial, tangential 3D slices to assess whether this teeth is present buccally or lingually. The relationship of this teeth to the root of mandibular molar, the relationship of the teeth to the inferior alveolar canal. We will also assess whether this teeth can be orthodontically brought to this position or we require extraction of this particular teeth. Let's move on to the other slices. We would go into the 3D slices. This is the buccal aspect of mandible. You can see the missing 3-5. So we will move on to the lingual aspect. So for this particular slice, this 3D image itself gives us many details. You can see the crown of impacted teeth positioned on the lingual aspect, lingual to the teeth 3-6 and 3-7. A portion of crown is present outside the bone and the rest is submerged within the lingual cortex. So we would store this image and we would assess the other details. So from the MPR slice, you can see that the slices are aligned along the long axis of impacted teeth. You can see that the impacted teeth is completely present within the bone, within the lingual cortex. Just a portion of crown is exposed to the oral cavity. And we would see, moving on from the superior aspect going inferiorly, you can see the root of the impacted teeth. This is the crown of impacted teeth. The crown is in close contact with the crown of the molar. That is one important thing which we have to consider. And you can see the inferior alveolar canal. So the root apex is not in contact with the inferior alveolar canal. It is just close to the inferior alveolar canal. So there is no possible risk of nerve damage. It will require some effort to bring this teeth orthodontically into the position in the edentulous area because it is far away from the edentulous area. Probably this teeth may go for extraction and we may have to plan an implant in this particular slice, and we can make use of this scan to plan an implant also in this area. So stay tuned for many more interesting videos related to cone beam CT, implants, impacted teeth, pathologies, etc. Thank you.